Hello, good day my dear friends. Today we are back to discuss about one very interesting clinical scenario which I have dealt with recently. So this child is around 9 months old child who was brought to the hospital by the child's mother. So by reviewing the history, the child had a common cold for nearly 7 days, for which they have taken medical attention and conservative treatment was prescribed for the patient. The child came to me with complaints of sudden onset of cough, which is for nearly 2 hours associated with shortness of breath. So the very definition of shortness of breath is having respiratory difficulty and fast breathing. So when the child entered into my room, I have examined the child and I found that the air entry is decreased on the left side. So when we put a stethoscope and check both the lungs, I found out that the air entry on the right side was significantly lesser when compared to the air entry on the left side. So I ordered for an urgent chest x-ray. So x-ray was also suggestive that there is increased air density on the left side and decreased air density on the right side, suggesting that the air inside the right lung is less than the air inside the left lung. This is in medical terms called as hyperinflated left lung. So then after the child came back to me from the x-ray, I started inquiring from the parent about what could be the possible reason for this. So they told me that the child is having symptoms of cold like running nose and nasal block for the past 7 days, for which simple basic medication like cetirizine and nasal drops were being given to the child and the child is taking them. So from the past 1 week there was no fever, the child is playing well till 2 hours ago. Suddenly, when the mother was cooking in the kitchen, the child had extreme bouts of severe cough associated with breathing difficulty. And on inquiry, the child is fully vaccinated as per the standard vaccine schedule according to the age. So it seems that the child was, when the mother was cooking in the kitchen, the child was playing with toys. It's like a small building blocks which we popularly called as Lego blocks or whatever it is, I don't know. So the child was playing with small building blocks which are really tiny and the child is able to hold with both the fingers. This is called as the pincer grasp. So recently the child had developed a pincer grasp and the child is also taking finger foods by himself. So then the child was playing with the building blocks, and since the child had developed the pincer grasp, there was a sudden episode of cough. So by correlating all these things, I asked the next question, does the child have a mouthing habit? Yes, of course, the mother replied that the child is having mouthing habit. Mouthing habit for some children is quite normal and it increases that is associated with increased habit of keeping everything in the mouth. So combining all these things, I was able to picturize that there could be something in the airway. So this in medical terms is called as a foreign body airway. So in the airway, whenever the something enters into the windpipe, so anatomically the windpipe and footpipe are situated side by side. So when something enters into the windpipe, there would be a sudden choking episode and a bout of cough, and some of them might extrude the foreign body also. But in sometimes what happens is when the foreign body enters into the airway, so just near the center point of the chest, it divides into the right main bronchus and the left main bronchus. So to clearly tell you the things, it divides two ways, one to the right side and one to the left side. So the right side is more straight and the left side is more perpendicular. So when there are more chances of a foreign body entering into the right main bronchus or the right major windpipe. So other possible diagnosis at this point of time I was thinking is could it be a viral bronchiolitis or a viral pneumonia, but since the history of illness is quite short, less than 2 hours with sudden onset of symptoms associated with shortness of breath and no presence of fever, so bronchiolitis and viral pneumonia have been ruled out and the final possibility of a foreign body airway has been kept in mind. So what is the treatment for this? So the child was admitted to the hospital and immediately a pediatric pulmonologist was called in to have a look at the child, and luckily since we have a full-time pediatric pulmonologist on board here, so we have done an emergency bronchoscopy. A bronchoscopy is a procedure that is done by way of a camera which is passed inside the windpipe and then to see where is the pathology or abnormality and to take it out. An emergency bronchoscopy has been done and the removal of the foreign body was planned as an emergency procedure. After which the child improved systematically, and there was a dramatic improvement in the symptoms, and within 24 to 48 hours the child was also discharged home. So this was one of the very important things I have seen in recent times, which I would like to share with you. And this is a very good message to all the parents out there. Whenever the child develops, an infant develops pincer grasp, and the child is playing with small toys or small blocks, please be mindful of the fact that the child can take them in and it might choke the airway. And once it chokes the airway, a bronchoscopy has to be done to relieve the child of the foreign body. This is a very important note that I would like to tell to the parents, to be very mindful of small things whenever the child is playing, and please personally see them or try to avoid giving small objects to the children. So thank you. So I hope this could be an important information to the parents, and to have such important information in future, please subscribe to my channel. Thank you.